are posting this to our website for those who weren't able to join in real time. And again, welcome. My name is Heidi Schumacher. I'm a pediatrician and former schools official now with the Vermont Child Health Improvement Program at UVM. I am joined by an incredible panel of awesome experts from all across our great state for this session today about leveraging health personnel and partnerships to improve attendance. This is the third session in our spring 2026 Zoom series, which is all about elevating innovative practices all across Vermont to help improve attendance. So on that note, you can see the series so far. Many of you joined our first session, which was really about chronic absence 101. A couple weeks ago, we had a session about student engagement strategies, really spotlighting work in Colchester. And today, again, you're going to hear from our great panel about how health personnel and partnerships can really contribute to improvements in attendance. Our last session will be next week. We'll remind you of that at the end, but hope folks can join that session as well. As a reminder, this work is part of our Everyday Counts project, which has been generously funded by the Leahy Institute for Rural Partnerships at the University of Vermont. That work really supported deep dives in the 4 communities with the red stars here, but also supported a statewide summit in the fall and other resources, including this series. We have a website that will include links for if you're interested in learning more about that effort. But really for today, I'm going to take down my slides and introduce our awesome panel. So the facilitator of today's session is the one and only Jess LaClair. She is a public health specialist and school liaison with the Vermont Department of Health, focused in Chittenden County. She is going to moderate a great discussion with Kathleen Bryant, who's a nurse practitioner at Gifford Healthcare, and specifically leads their work in school-based health centers. Kelly Marcus is a school nurse in the Champlain Valley School District. And Kara Gleason-Krebs is the school services director at the Howard Center, doing great work to support our young people's mental health. So with that, I'm going to turn it over to Jess and really appreciate everybody being with us today.
And I just wanted to check, can everyone see our slides? I just put them up. Okay, great.
Yes, looks great.
Okay, awesome. Well, welcome everyone. My name is Jess LaClair. I'm a public health specialist, and I'm also a school liaison from the Burlington District Office of the Vermont Department of Health. I work closely with many school and agency partners in Chittenden County to help address chronic absenteeism as part of my work. And I am lucky enough today to be joined by 3 panelists, and each represents a different school-based health service. And I'm going to introduce the 3 of them on the next slide. And together, we're going to share some ways you can leverage health services to improve attendance. So school-based health services include school-based health centers. And today we have Kathleen Bryant, who's a nurse practitioner with 20 years of experience in the school-based health center space, joining us from Gifford Healthcare, a federally qualified health center. She works within the Randolph schools to provide school-based health center care. And while not all of you currently have school-based health centers, most, if not all of you, have school nurses on staff. Kelly Marcus is a school nurse, both at the Heinsberg Community School and at CVU, the high school, Champlain Valley Union High School, with 40 years of nursing experience. She was originally hired as a school nurse through special education funding to case manage medically fragile students. And she has worked in school health for the past 10 years and loves it. And she has made addressing chronic absenteeism a priority of her work and joins us today to represent school nursing. And last but not least, Kara Gleason-Krebs is the school services director at the Howard Center, which is our designated mental health services provider in Chittenden County, Vermont. She is a clinical social worker who oversees all the Chittenden County school services supervisors and supports population level mental health related work in schools. And she also has experience as the director of Howard Center's Northern Lights program and as the school services supervisor for both Burlington and South Burlington school districts. So I'm going to turn the mic over to Kathleen now so she can give us a brief introduction to what a school-based health center is and some of the ways that they can support student attendance.
Great. So thanks for having me today. And I'm always really excited to talk about school-based health centers and what we do in our work. And As you all know, I'm a nurse practitioner. I work in Randolph for Gifford, and we provide services to kids within the schools. And so school-based health centers look a little different in Vermont than maybe they do in the rest of the country, but typically it's an extension of the primary care practice, a school-based health center. So I work for Gifford in the pediatric office, but I'm embedded in the schools 3 days a week, seeing kids here in the schools. And that's how most school-based health centers work in Vermont. So they might be part-time in the schools. And we provide preventative services. A lot of times we do well child exams. We can also provide acute care, dental services, and mental or behavioral health. And each school-based health center might be a little bit different in terms of the services that they do offer. But that's generally an overview of how we do things. Sorry, there's an announcement. I'm in school today, but I'll try to keep talking through it. So we really end up serving a lot of kids who struggle to access medical care in the traditional ways. And that can be for a variety of different reasons. Maybe there's transportation challenges in our rural communities. Sometimes people don't have access to vehicles. And so getting them to appointments after school can be super challenging. Maybe there's parents that work full time and they just can't make those typical 9 to 5 hours. And so we can see those kids in school, which eliminates that need to take them to appointments. And then that really can help with like reducing the amount of time that kids are missing school. So if I do a visit in the school, it means that parents don't have to come pick up their kids and bring them to the office and then miss the rest of the day. So we really find that that helps improve attendance. And we can also address chronic health problems in the schools so that like little things don't become big things and keep kids around. So things like addressing asthma management and then making sure that they're managing those symptoms optimally so that then they're not missing school for chronic problems or having ER visits. So we know there's a lot of great research out there that shows that there is improved attendance among students that do access school-based health center services. So we really think it's a great model. Do you want to go to the next slide? So we were able to do a study last year and we just repeated it and we're working on analyzing the data this year where we took like a snapshot of a 2-week period for Vermont school-based health centers. Right now there's about 21 to 23 school-based health centers in Vermont and that varies a little bit because there is a little bit of coming and going depending on funding issues. But we were able to gather data from most of the school-based health centers in Vermont and look at the reasons that kids were accessing services in Vermont for school-based health centers. And what we found is that there was a wide range of what kids were being seen for. And that varied from things like colds, coughs, congestion, to even physical therapy. So there was a group up in the UVM area, in the Chittenden County area, that had physical therapy students coming in and providing services to kids right in the school. And then also bringing an ophthalmologist in to do eye exams for kids in the school. And the interesting thing is there was a huge number of mental health issues that were addressed. Over 30% of the visits in this 2-week snapshot were seen for mental health issues. And that ranged from ADHD to anxiety to depression. But we really find that we're meeting kids' needs. It's a huge issue in Vermont right now. And so we're really able to help meet those needs for mental health issues. But some of our most compelling data that came out of this study was how much time we were saving kids in learning. So over 86% of kids that were seen in a school-based health center went back to class after being seen. So typically you may have a kid that comes in for a cough and then the nurse needs to send them home because this cough is disrupting learning. But then if we're able to see that kid and maybe do a nebulizer treatment or address their asthma management and get them back to class, that keeps them in school. So that's what we found consistently in our study is that most of these kids were going back to class after being seen. And that helps minimize disruptions to caregivers for missing time from work. And it helps eliminate those transportation barriers too. And then we used a tool called the Seat Time tool that's the National School-Based Health Alliance has this tool that we can use to sort of look at how much time we're saving kids in learning by having a school-based health center. And we found that we saved an average of 3.6 hours of time for kids. So, on that assumption that if a kid left at 9 o'clock for an appointment that they may not come back to school, we're really looking at that and seeing that we're saving kids a lot of instructional time by being there in the schools. So the overall findings were that school-based health centers provide access to medical care to children that might not otherwise receive care. And we find that we pull kids into care often. Like there might be a kid that's new to the community and hasn't established with a primary care provider yet, and then we pull them into care. I do a lot of work with kids that are kids of migrant farm workers, and so we do a lot of things like catching those kids up on immunizations, pulling them in for services, and it can be hard for those families to get time off of work to come in And so we really help those kids that are really struggling with accessing services.
Thanks, Kathleen.
Yeah, you're welcome.
Next, Kelly Marcus is going to share some information about what school nurses do and how they also support stronger attendance in our schools.
My name is Kelly Marcus, and like Jess said, I work from 3-year-olds up to our 22-year-olds. So I see a wide range of kids. And I've also been lucky enough to work in the Burlington School District and Winooski School District, which also has its unique challenges. So school nurses, I think we get a rap for just handing out ice packs and Band-Aids. And I'm such a believer that that's where our connections and relationships actually start. So I am so passionate about the work that school nurses can do and these areas of health management, mental health, health education, crisis management, and advocacy and access. And I really believe school nurses are underutilized. And I'm lucky enough to work in schools that we have 1.5 nurses or 2.5 nurses, which also makes my job easier. But in health management, we take care of all the kids with the chronic health conditions. It could be asthma, seizures, allergies. We do all the screenings in the school for hearing and vision, because if students aren't able to see or hear, that, helps them be in class and be at school and getting the most out of it. Mental health support, I would say at least, I don't know if there's statistics on this, but at least 75 to 80% of our day is spent with mental health, such as anxiety, depression. Even I'm seeing this in kindergarten the last couple of years. Kids come in with the tummy aches, the headaches, and teaching skills, in conjunction with the teachers and our social emotional learning and guidance, I guess really helps these kids be back in their classes. And then we also work in conjunction with the families to help them, guide them how to help their children. Health education, we, as school nurses, any kid that comes in with asthma or a seizure, we write health plans. And those health plans are communicated to teachers, for allergies, to the cafeteria workers, to the bus drivers. So we educate the kiddos on how to use their inhalers. We help educate the bus drivers how to use an EpiPen in case of a crisis. But most of all, we're always advocating and teaching the children. And that's our most important job, I believe, is to empower them to be able to take care of their chronic health conditions, because they're going to have to live with it for their life. We do crisis management in that it could be our kiddos in wheelchairs with mobility issues. We have to come up with safe plans for the fire drills or all of our drills, even if a bus accident. So very complicated in all the things that we do and can reach out and help so many people. Infectious disease was something that came up last year with the measles outbreaks. So, as school nurses, we're already gathering lists of the kiddos that we know aren't immunized and what might have to happen next. So we kind of have a hand in a lot of different things. And I'd say my biggest thing I love about school nursing is the advocacy and access to help care coordinate, to help children and their families. We, like in Burlington and Winooski, and we have a much lesser population of new Americans, but to help them even get insurance, get into dental, vision, connect them to doctors is a process I love. And so I think, yeah. And so there have been some studies done, and it has found that schools with full-time nurses are more likely to reduce that out-of-class time, just like Kathleen said. I think one of the studies said if there was a school nurse in the building, 95% of those kiddos went back to class compared to 82% that didn't have a nurse in the building. We're able to decrease absenteeism because we can talk to families about when they can come back to school and how we can help give the inhaler or possibly so many things like strep throat. We can give that antibiotic, pink eye, all that stuff. So we really help get the kids, and especially related to asthma, we can do that. And so all those illness related problems school nurses can help families with, which greatly improves attendance.
Yes, can I jump in and ask a question
Yes.
from the chat?
Yes.
So I should have said this from the beginning, but you heard Kathleen talk about school-based health centers. Kelly talked about school nurses. Kara's about to talk about school-based mental health providers. I want everyone on this call to be thinking about having a school nurse, having a school-based health center, having a school-based mental health clinician is an attendance intervention. So if you're in charge of attendance for your school, for your district, if you're part of an attendance team, and you're thinking, we've never really considered having a school nurse in attendance intervention, having the school nurse on the attendance team, having a school-based health center as part of our attendance intervention, then I'd encourage you to think about that, because as these folks have said, there's so many elements to what they do as part of their work. And much of that can directly or indirectly lead to improved attendance. Kelly, I want to ask one question. Dave Kelly from the Agency of Education's data team is wondering if you can share insights whether nurses, or Kathleen, for you, for school-based school-based health center professionals, do you keep a chronic illness flag for kids? Like how do you track and or communicate to others within the school the connection from a data standpoint between chronic illness and attendance patterns?
I know that's such a great question. Well, our electronic health record that teachers have access to, we as nurses, we actually put those health plans in. It would be iconed with a medic alert symbol. And if you click on that, it brings up the health plan. So all teachers, have that alert for any child in their class. And as school nurses at the beginning of the year, we also personally go to any child with those health conditions. It's, like I said, iconed. This is throughout our district, at least. And we go and have one-on-one talks, first a conversation with the family about what they want relayed and what important topics they want known to the school. And then we actually go and speak with the teacher, the cafeteria workers, the bus drivers, and we teach them to use, like I said, the EpiPen or those things. So yes, teachers have access to that in my district through my electronic health record. And I saw another thing pop up because I'm a huge advocate. It would be my dream to have student-based health centers. I would love to work with Kathleen. And I was so lucky to have that at Burlington and Winooski. And I know a question came up about telehealth. And so, yes, that even if I don't have a student-based health center in my district currently, but we do aid with telehealth visits for kiddos by taking blood pressures, doing vital signs, and then helping get these children on a telehealth visit. So yes, nurses are important.
Thank you. I'm going to move into, and keep the questions coming, but I'm going to move into school-based mental health providers and turn this over to Kara for the next few slides.
Thanks, Jess. I love that, Kelly. Yes, nurses are important. Hello, everybody. I'm Kara Gleason-Krebs, as Heidi and Jess shared, and I'm the Director of School Services at Howard Center. We have the co-hired school services clinicians in the schools here in Chittenden County. And I was a school services clinician at the IAA in Burlington previously. And I also coordinate the Chittenden County Chronic Absenteeism Work Group, because chronic absenteeism is an issue that we are really trying to support families with, and watch, over the last 10 years, really have watched our system struggle to respond. And so are really interested in bringing folks together. So this is so excited to have these workshops. So school-based mental health services, there's so many different ways to provide school-based mental health services, and this will look different in different schools and different counties and different states, right? So there's lots of folks that provide mental health services in schools. You have, of course, folks know your school counselors. Um, Sometimes schools bring in outpatient therapists who maybe don't work for the district, but are meeting with kids individually. Many school districts direct hire mental health folks like social workers or mental health clinicians. Of course, there's school psychologists. SAPs I always think of as providing some mental health work because they do a lot of work around communication and social skills. And then in Vermont, we have this unique model of the school-based clinicians, which is a cost share between Medicaid and local education dollars to have mental health clinicians and the resources of the community mental health agency right in the school. And so you can see here, these are all the different things on the screen that mental health folks can do in schools, right? Individual-based interventions, which could look like therapy, and also lots of times look more like skill building with kids and youth and families. Case management, which is so extensive, really, and thinking about especially when there are complex mental health needs and complex family needs. The mental health challenges, as you all know, are sometimes not just with the young folks that we're seeing. Families struggle, everyone struggles with their mental health at different times. And so the case management can be supportive to the whole family and the school system, really. We do lots of external referrals, connecting folks. That's part of the benefit of the school-based clinician model, because we're connected right to that DA in the community, and do lots of work supporting connections with our medical homes, of course, and all of the now case managers and social workers in our medical homes, which is such a benefit. And then group-based interventions, which again is often skill building and can be very effective in terms of bringing groups of kids together who are struggling with similar challenges, and or a mix of kids, that where we can work on some skills and different things together. Needs assessments are happening, really in many schools for everyone. Mental health or skill building need assessment happening for everyone, either done by the young person or by the teacher. So we can really take a look at what's happening and provide different levels of intervention. And then I talked a little bit about family intervention, outreach, and telehealth delivery. So those are all the different ways that mental health can be provided. I think one of the best benefits of having it right in the school is, one, building that bridge between the family, the youth, and the school. Sometimes there can be challenges when a young person is struggling, because we all care so much about them. There can be challenges amongst the adults at times, and mental health folks in the schools can help be that bridge and work. And then also education and support for the school team in terms of responding to the specific needs of the young person. Mental health support can be so individualized, it's so relationship based, and all of our teachers and school staff do an amazing job of responding to each of their students. And so having somebody on your team who understands what's going on, has worked with the family, and then can support the school staff in doing that individualization can be super helpful. I think we can go to the next slide. So what does the research say? School-based mental health services are as effective as outside traditional outpatient services. And yeah, as this says, does a better job of engaging and retaining families, works on stigma, works on access, because we all know it's so hard to get access to mental health just in general for anyone, and for folks who are struggling. And yeah, reducing the stigma. I mean, having mental health folks in your school can really bring a level of mental health literacy to the whole population, which really makes it easier for anybody to access supports. And so there's some data here I did want to share too. I pulled out, so here in Chittenden County, our school-based clinician program last year we reported on services. We had 859 formal clients, so that's across all the schools in Chittenden County. And then 1,646 informal clients. So that's young folks that we did an individual intervention with, had in a group or a screening or something outside of actually our clients. And we made 1,805 referrals to community connection. So that's sort of the level of connecting to the community. And I'll just share a little bit about, we do extensive surveying with the caregivers of the young folks that we work with, actually with the students at all ages, and then with our school partners. So of our caregivers, we had a 43% response, which is, I think, quite strong. We're proud of that. And 91% of them said my student and or my quality of life improved because of the services. Of our school partners, and we had 950 folks respond. So these are folks working in schools. 91% said the students are better able to access their education because of the services provided by school services. And 91% said that services had a positive influence on the relationship with the families. And then for our younger students, 85% of them said my school services clinician helps me feel more comfortable at school. And of our older students, 87% said I received the help I needed from the school services clinician. So that's what our folks are telling us about the services.
Thank you, Kara. I accidentally hit the button too soon. We're now going to talk a little bit about health-related absenteeism. We're going to talk a little bit about what is most common. And before we get into some of that, we'd love to hear from you. So you'll see that there's a QR code you can scan and enter what you feel like might be the most common health-related absences in your school district. And we kind of made them into different categories. So we have acute physical health-related reasons. So those would be things like flu is an acute illness, strep throat is an acute illness. We also have chronic physical health-related reasons. So that could be something like asthma. And then we also have mental health-related reasons. And then we have, you know what, I'm not sure. We really aren't tracking our data that way. So if you feel comfortable, we would love to get folks to put some info in the chat or in this, and it's supposed to work. I've tried it, it worked here.
It works.
Okay, good. I'm glad it's working, although I don't see it changing on my screen yet. I wonder if there's something I have to do. I didn't have to before.
Yeah, someone was wondering if you could put the link in the chat and maybe folks could access it that way.
Sure. Let me copy it. And I need to open the chat.
I can do it for you, Jess, too.
Thank you. That would be great. And I'm just going to do this and see if this gets it to refresh. Well, I am sorry. I do not see it refreshing, and I don't see any changes happening on our end. So I apologize. It looks like we have an issue with this specific thing. But I hope people have had a chance to think about this one, because what I really want to show you are some of the responses from last time. Yes.
How about if folks put it in the chat?
Yeah, if you want to put it in the chat, that would be great. And I can actually open it so I can see the chat too, because I can't right now.
So I can moderate the chat, Jess, for you. So far, a mix of mental health and acute health is most resonating for folks.
Yep. And that sounds pretty similar to what we've seen.
And Andrew, I appreciate your comment. Mental health related reasons, including I'm too anxious to come to school, so I feel sick. Right? Because we know not all mental health shows up as people identifying that it's mental health. It might be the bellyache. It might be the.
Yeah, and actually, I'm glad you said that because I'm gonna just keep us going and I'm gonna show you the results from Killington because we asked this question at the Killington conference, but we asked it without the category. So we just said, what's the most common reason? So people might say mental health, they might say asthma, they might say flu, but they didn't really say acute or chronic. So let's take a look and see what people said. So this was of everyone there, 28 people responded. And so I looked at those responses and I put them in the categories that we just had and saw that over half the responses really, they're not clear as to which category they could belong in. 4 of them really clearly belonged in probably, right, an acute physical health. Strep is an acute illness. Fever, usually associated with an acute illness. And then there were 2 that were really chronic health related. Asthma, cardiac issues, both seemed like they would definitely be chronic. Cough could go either way, right? You can have a cough with an acute illness or a chronic illness. Mental health, there were 6 that were really clearly in the mental health category with 5 anxiety and 1 avoidance. But then there were 14 sick, stomach ache, headache, and lack of sleep that could be related to any of these. And I feel like even when we're tracking our data to try to figure out why kids are absent, sometimes our data doesn't really tell us enough right there. And this really just drives home to me how important school health services are because they can help us assess individual student cases to determine what we are seeing and figure out like, what does sick mean? You know, what are we actually seeing? What is the real driver here? And I will talk about nationally what the top drivers are. So top health related drivers of student chronic absenteeism are mental health and trauma, asthma, and oral health, dental health issues. And that's what we see nationally. And I think we see, based on my experience, which is Chittenden County, but we see a lot of those things here too. So we're going to talk a little bit about those. First, I'm going to talk a little bit about mental health and trauma. And so I wanted to share this content warning slide because this is not an easy topic. Our kids deal with a lot and it can be hard for us to deal with. So again, just kind of wanted to make sure that you knew that you can take precautions, you can step away while some or all of the content's being presented. And if you or someone you know are in need of support, feel like you should call the Suicide and Crisis Line at 988, or you can text Vermont to 741-741. Text VT, I should say. So trauma and mental health. A lot of poor mental health can be traced to trauma, and the YRBS collects a lot of that health and trauma related data. I'm not going to dive into it in detail. I'm going to go through this real fast because I want to keep us moving forward. But no, there are often significant differences in prevalence among subgroups. So the YRBS looks at a few different subgroups, LGBTQ versus cis het students, BIPOC versus white non-Hispanic, male, female students. And at the high school level, you can also look at students with or without an IEP 504. So this is just a quick glance with a surface level overview of some of the mental health and trauma related data about Vermont middle and high school students from the 2023 YRBS. So we know that about 1 in 50 students in both middle and high school report being hungry most of the time or always within the past 30 days. 1 in 25 high school and 1 in 50 middle school students report experiencing unstable housing during the past 30 days. And in this case, unstable housing means, sleeping in someone else's home usually, or at a shelter, in a motel or hotel, in a car, park, campground, or other public place because they didn't have a usual place to sleep. About 1 in 15 high school students have a disability or long-term health problem that is significant enough that it keeps them from doing everyday activities. Nearly 1 in 10 high school students report being threatened or injured with a weapon on school property within the last year. About 1 in 7 middle school and 1 in 6 high school students report having seen someone get physically attacked, beaten, stabbed, or shot in their neighborhood. About 1 in 5 high school students and more than a quarter of middle school students report having been bullied in the past 30 days. And nearly a quarter of high school and 1 in 8 middle school students have ever had someone do sexual things to them that they did not want. And nearly 3 in 10 high school students live with a parent or has lived with a parent or guardian who has a problem with alcohol or other drug use. And 1 in 4 middle school and 1 in 3 high school students reported that their mental health was most of the time or always not good in the past 30 days. So when we think about all of these things, like these impact our students and their ability to learn, because it's pretty hard to prioritize learning when so many students are impacted by such by mental health and trauma. Moving into asthma. Asthma is really common too in Vermont's children, just like it is nationally. So about roughly 1 in 14 of our children have asthma, but over half of them have what's called uncontrolled asthma. So they're symptoms that are causing challenges. And for a little over 1 in 5 youth with asthma, they have what's called severe or moderate persistent asthma, which necessitates multiple emergency room visits and really can significantly impact their daily living. In 2022, which is the last year I happen to have the data for this, but there were 420 emergency department visits and 58 hospitalizations due to asthma among Vermonters under the age of 18. And then the dental health concerns, to talk a little bit about that in Vermont, we do have a shortage of dental practices in Vermont, and we have an even greater shortage of providers who take children with Medicaid. So according to Keep Smiling Vermont, which is our oral health of Vermont Children's Report from 2022 to 2023, dental health concerns continue to rise for elementary school students. Over 40% of them have experienced tooth decay, and that is a rate that's significantly worse than had it been in recent previous years. Dental care needs have increased significantly in the past 10 years. 1 in 4 Vermont elementary school students needs dental care. And we know that schools, elementary schools that have more children who are eligible for the National School Lunch Program are more likely to have children with tooth decay, which makes sense considering that those are also students more likely to have Medicaid. And we know that kids on Medicaid are less likely to be able to find a dentist. So I'm going to change this. We're going to start talking. We're going to have our panel discussion, and we're going to talk about some of these health issues and how we can help address them in our schools. I'm going to share some quotes that I have from some Vermont school nurses and counselors. So I'm going to start with a quote from a school nurse. The mental health needs are the greatest. Students are really, really struggling daily, multiple times. Just today, students have come in with emotional, mental health issues, cutting issues, depression issues, sleep disturbances. Anxiety is huge. It's big. So what I'd like to do is ask our panel, if you would like, and I know it's hard because we're not in front of each other and people just to speak up, but tell us a little bit about some of the supports that you provide for individual students and caregivers around mental health, and also maybe a little bit about some of the population level interventions that you can think of that are helpful to decrease trauma or the impact of trauma on the mental health of students. So I guess let's start with individual student support first, if anyone wants to take that away.
I'm certainly happy because that's sort of where I feel like we have the biggest impact is with the individual students. So we do a lot of prescribing because kids really struggle to get access to psychiatrists in Vermont. I just had a kid wait a year to get in with a psychiatrist. So we do a lot of prescribing. One of the beauties of being within the school system is a lot of times I can go into the classrooms and do observations on kids with things like ADHD. And it's super insightful to me to get to see the kid in their classroom environment and then be able to tailor their medications to what the needs are. So that can be really helpful to me. And it gives me this direct access to teachers to really find out what the kids' issues are. So I think that individual prescribing can be really helpful. And then I also can interact with the school counselors who often know a lot about these kids that they're seeing on a regular basis too. So I think that's where we have the biggest impact with mental health needs.
Thanks, Kathleen.
I know. I'll chime in at our school too. Like Kara said, we have Howard social workers and also our own guidance counselors and SAPs. And along with, we have a mental health team at the high school, and we have MTSS meetings in our elementary schools where we bring up these kiddos, and then everyone can give their input, and that way we can move forward the quickest. Connecting the families and the students with resources that we can provide.
Thanks, Kelly.
Yeah, and I would just add, I mean, the work is often, as most folks know, relationship building, validating, leaning in, and really trying to understand the situation, which is often much more complex than what's brought to you, right? I mean, I'm sure nurses feel exactly that way. Often the problem is not the problem, right? How do we really understand what's, driving the anxiety or the worries? Kids have really complex, hard things happening in their lives, and really trying to help them figure out what's happening for them, what can be changed. Sometimes it's about understanding diagnosis, right? Like what is the root mental health challenge, and sometimes it's more complicated than that. Really understanding how to support their family in different pieces. So um, I would agree with Kelly too. The teaming is so important in terms of trying to have all the different folks understand, bring the information they have from different perspectives to try to support the young person in understanding what's happening for them. And then, I mean, like I said, relationship building, right? So safety is key, especially if you have experienced trauma, and safety is relational, and having people you can trust takes time.
Thanks, Karen. That actually leads into, you mentioned team approach, and again, having different people who see different aspects together at the table. And I wanted to ask what external partnerships have been most helpful or would be helpful to have in addressing some of the mental health needs of students.
Well, one thing I'd like to share, and it might kind of be like about the last conversation, but we were having a meeting for a seventh grade student who has issues with seizures. And only because we were able to bring our nurse in with all of her knowledge, were we able to figure out that sometimes this medication has a side effect of anxiety and some behavior dysregulation that nobody had noticed for years and years, that this was a possibility. So only by having our nurse in place were we able to have that conversation, and things have changed for that student remarkably. So, I mean, I cannot stress enough. We think we know it all in the school. We sure don't. And having that professional expertise really makes everybody feel more at ease, I think, because we know that it's from a valid source, and we know that it is, legitimate and medically proven. So it gives us confidence to act on whatever interventions we put into place.
I know, that's so awesome, Andrew. And I'm going to add on to, because Heidi, we did Vermont Child Health Improvement Project this year, is about the connection with schools and the medical providers. And so I'm super lucky to be part of a pilot this year. And that's knowing who my peoples are in the community. I'm able to get right into the mental health provider or just the pediatrician to get people the help they need in the moment. And other people don't have that access.
Thanks. And then the other thing I wanted to touch on, still on mental health, was population level interventions that can be helpful for decreasing trauma or impact of trauma. I know some of the hidden slides we have in this presentation, because we're not able to, we have to keep it moving, but are on things like, we know restorative practices, for example, tend to reduce trauma. Are there do you ever do any work around that at a population level with schools to make maybe systemic changes that could be more supportive for students around mental health or trauma?
I have two thoughts on that. I mean, one is all of the anti-bias, anti-racism, anti-ableism work that we're doing in our schools and continue to do, because it's important, kids' experience in schools. And then additionally, I mean, I think K through 12 curriculum related to mental health and regulation and skill building, we all really need those building blocks. The statistics were showing, almost everyone is feeling like they're really struggling, right? And so really starting in preschool or kindergarten with regulation skills, and, anytime that we can have a curriculum that builds on itself, right? So that when a child is 16 and they're struggling, they're hearing the same language and the same skills that they were being, supported around developing when they were 6. That can really build a lifelong capacity to have control over what's happening in our bodies and our minds.
That's very helpful. And we definitely have some of the hidden slides about social emotional learning, because that is so impactful for mental health. And it is a population level support that can be in place in schools.
Jess,
and
can
I
I jump in
appreciate
with
the
one
work
other
on
thing
bias.
too?
Yes.
I mean, you just heard a little bit about sort of other partners, and
Yes.
I want to just lift up again, leveraging your in-school folks to loop in your out-of-school folks. So primary care, community-based mental health, et cetera, can be huge connecting opportunities. One, because folks may have a trusting relationship with their pediatrician that feels different from the relationships that they have within the school. But two, because we're doing work all across the state to really engage and empower primary care practices as one example, to be asking about school attendance. And just as one example, in Franklin County, Monarch Maples Pediatrics in Enosburg and St. Albans, they've been screening for absenteeism at well child checks. They identified that a huge population of kids they were screening for absenteeism acknowledged mental health. So they did a workshop last summer with patients in their practice on anxiety reduction skills that those patients could then bring into the school year. So don't forget your primary care colleagues. And again, your nurses are great folks to engage those people. And in almost all cases, your school nurses will know who the leading primary care practices might be in your area. They can be a great resource.
Thank you. And I'm going to move right into oral health. I feel like we could talk about this one for much longer, but I'm going to go right into oral health. And the next quote I have is actually from a school counselor, not a nurse, but I would love for there to be a way for kids to get their teeth fixed. We have so many kids who come in with rotten teeth, or they have not been to the dentist, and I see it so often. It affects their behavior and their ability to learn at school. Some of these kids, their mouths just really look like they're in pain, and they're complaining about their mouths hurting. So I'd love to hear, I know it comes up a lot, especially with younger students, so more likely to complain about tooth pain, but do you see an association between oral health and health office visits or behavioral health visits in your practice? And if so, can you talk a little bit more about that?
That for me, that has been a huge, a challenging issue. And look, I'm going to plug Burlington School District in Winooski, because they are so unique that they have dental clinics in their schools. So kids have access to dental, teeth cleaning, fillings. So for me now at CVSD, my biggest area was lots of my new Americans. And so I cold called many dental places. Like Jess had said earlier, no one's taking Medicaid. And if they are, they don't have room to fit new patients in. So I've found my resources, Community Health Center, Green Mountain Pediatric Dentistry, and then also with that language barrier, lots of people don't have transportation to get to these places. So once again, it's collaborating and coordinating. And yes, these kids miss school because they're in pain.
Yes. And I know, Kathleen, you had talked about this before at Killington as well.
Yeah, I just said in the
sorry,
chat, no, we have, so Health Hub in South Royalton operates a dental van. And so that van then travels to different schools. And so we have that van parked at one of our schools, and the kids come there for dental cleanings and screenings. So that's just a really helpful way for kids to access dental services in the schools. So that's been super helpful.
Great, thank you. And I also I'm just going to plug, there's a program called 802 Smiles. Both Burlington and Winooski are part of that program. But 802 Smiles is something that you can reach out to your local school liaison for more information on, but we can help get you connected if you are looking to figure out a way to provide some dental care within the schools to support your students, because there are options for that can be pretty exciting.
Can I just add really quick too?
Yes.
Dental pain really affects our mental health. I think we've all felt that. And there's a big component to accessing dental care that's related to mental health. It's incredibly vulnerable to have someone touching your face, putting their hands in your mouth. And I think sometimes when we can be frustrated with a family or a young person because they're not accessing dental care and it feels like a lack of follow through, that can be a good place to sort of step back and start talking with families about what is this like for you? Have you ever been? What's your experience? How can we support you in getting access to that care? Because it might be really scary.
That's a really good point. Thank you for adding that. And I know with our 802 Smiles folks, we have people that take, we have hygienists in school that walk through and kind of, especially with younger kids, but working around some of the fear or even just not knowing what to expect. It's not quite the same thing as what you're talking about there, but they do a lot of work to try to create a safe and trusting environment for students to access that kind of care. I'm going to go right into asthma. I wanted to share this quote. I like this quote because it shows kind of the breadth of response that can happen in a school. So this nurse is writing about, they had a student who has severe asthma, and they've had significant absences related to exacerbations of that asthma. And they worked with the parents and the primary care provider to obtain an asthma action plan, along with daily and rescue medications that were needed to control or help with an asthma attack. The students' parents used tobacco products, so they were referred to 802 Quits to help mitigate the secondhand smoke exposure. And since then, the students had less severe asthma exacerbations that require hospitalization. They've become more compliant with medications, which has greatly reduced their asthma attacks and the need for rescue meds. And this has had a significant impact on the students' absence, as their days that they've missed has decreased greatly. So I love how multifaceted this approach is and how involved the student's whole team, from parents to primary care provider to the school nurse, were in achieving the outcome. So this is for a child whose asthma was recognized, but again, it's not always clear when a child's asthma symptoms are the reason that they're not at school. Families, and I have a child with asthma, and would call my child in sick if he was having issues with asthma. I wouldn't call him in with asthma. And one of the school nurses that I had talked to recently, was interviewed recently and said she has two groups of kids. She has some that flare ups in the fall and the spring due to allergies and activity, and another group of flare ups in the winter related to going out in the cold and how that impacts their lungs. Do you see absenteeism or health visit patterns among your students with asthma in your schools?
I don't see as many because we're really on top of it, like you said, with our identified. One of our biggest challenges is helping the parents navigate to get an inhaler at school and also at home for our little kids. By high school, they know how to do their own inhalers. So I don't see it as much in CBSD, but yes, from smoking families and just environmental. But that's where, as school nurses, we can help coordinate and collaborate with the families and the pediatricians or allergy asthma doctors.
Yeah, thank you, Kelly. Kathleen, what about you?
Yeah, I mean, I think that's a really good point about calling in sick versus calling in with asthma, right? Like we don't always identify the differences, but I do think that our asthmatic kids, we do a really good job of knowing. It's one of those chronic diseases that I think that people are really very aware of. And so we do those asthma action plans, and having me in the schools helps with doing those asthma action plans to make sure that the school nurses have access to the asthma medications that kids need. But of course, there's always a couple kids every year that, are newly diagnosed and really struggling with when to use their inhalers. But I think that's a perfect opportunity for us as a school-based health center and school nurses to do some education. And so I think that's when we can really leverage those medical partnerships to make sure that kids get better care.
Yes, I agree. I think that external partnerships are really important when it comes to managing asthma. And I wondered about population level interventions, at the school level that could potentially help students with asthma.
Yeah, I can definitely speak to, an asthma-friendly school. So the health department has a program with asthma-friendly schools, and our school just became an asthma-friendly school. And so it's things like, making sure that buses aren't idling outside, and using, non-toxic products to clean with. So our nurses have really made a push to implement that this year. And then one of our school nurses is trying to kind of anecdotally track asthma absences this year to see if it's made a difference, some of their interventions. So I think that is an example of population level programs that can be helpful with improving kids' health.
Thank you, Kathleen. And right now, I believe it's 32 schools for this past year applied to be asthma friendly. 16 of them are Chittenden County, so shout out to my Chittenden County schools. But it is so helpful. And it doesn't have to cost a lot of money. A lot of the interventions are low or no cost, but they can really make a difference for kids with asthma. So if you're not already participating in asthma-friendly schools, I think May 31st is a deadline to apply for this year, and it is well worth your time. You may find some things you could do a little differently that can really make an impact. And now I'm going to move on again because I know we're really getting low on time, but health-related misconceptions that contribute to missed school days. So misconceptions are reasons that parents or caregivers may excuse their child from school when in fact it might be more appropriate for them to be there. We see misconceptions around mental health days, sick policy, and vaccine safety as some of the top misconception related contributors to missed school days. And I'm going to let Kara talk a little bit about mental health days.
Yeah, I mean, this can be a tricky concept. And I also I was just reading Valerie's comment in the chat, which I think is not the same, but part of this conversation, which is really important, that there are so many young folks, families with complex health and mental health needs, and the traditional concept of schooling or traditional schools may not be the best fit for some young people as well, maybe a different population or that same population. I think, yeah, it's a really important point. How do those folks fit into this conversation? I think some of the work that we do in schools, because of the high tier of individualized care coordination and support, do try to work with families to figure out what could work for them in school, also meeting the needs of what's happening for their kids and families, and maybe trying to adjust the day or the schooling to meet the needs of the family and the child. And that's what mental health days, I would say, there are lots of folks who talk about how a mental health day can be very supportive of a young person. Adults take them as well. I think we see that as part of our dialogue nowadays. And what I also really like to always think about is it's more about understanding yourself and what you need and working with young people to try and figure out why they're feeling overwhelmed and stressed and what helps them feel better. So for some folks, a mental health day or being less overwhelmed or stepping away from their stress may be what helps them feel better. And for some folks, it may actually, stepping away may actually exacerbate their challenges to get to school because it reinforces some of what their anxiety is telling them. So it's really complicated and it depends on who you are. And I think when folks have complex health and mental health needs, we need to be really careful to tailor our response to meet them as opposed to making broad statements about what works for everyone.
It's very important. Thank you. We're going to talk a little bit about sick policy as well. And Kelly, if you could tell us a little bit about that.
That's still, we're still educating since COVID. Many families are still reverting to calling and saying my child is out 5 days because they have sniffles, a fever. And so it's really been re-educating both our staff and families. And so, at least in my job, I look at the absent lists and we're alerted when kids have missed more than 1 day. And we're making phone calls home to talk with families about that. And they can be at school with head lice, mild rashes, all the stuff you're allowed to be at school. And like I said, it's also that bridge to the to teachers also, because they get boomeranged back to our health office with teachers wanting them to go home. So just re-educating, we're taking it one step at a time with that.
Thanks, Kelly. And because we are running out of time, I'm going to just kind of whip through it to the end of our slideshow. There are obviously more things we could talk to you about. I want to end with that it's important to optimize the impact of your health services when you integrate school-based health service staff into your student support teams. That really can make a difference in addressing so many of the root causes of absenteeism. Engaging them in population level work, because when we have large groups of students being chronically absent, it would behoove us to consider system changes that could help make the environment work better for those large groups of kids, and enabling school health services staff to better partner with families, provider practices, and community supports things like bidirectional supports or bidirectional consent forms and other things that you can adopt can really make a difference there. And I think I just want you to know you will get the slides afterwards. So I apologize for not getting to see everything here today, but we have some really great resources that you can have access to as well. So if we go to the very end, there's a whole bunch of resources. There's some really interesting health handouts from attendance works that I recommend you check out, along with some self-assessments for health services that are really interesting to look at. You'll see things like the asthma-friendly schools and 802 Smiles referenced here as well as Kathleen's guide to opening a school-based health center in Vermont, which is really awesome and exciting too. So I'm going to stop sharing my screen, or Heidi, you can help me stop sharing my screen.
Oh, yes. And I will close us out. Thanks to our amazing panel. Thanks everyone for listening and the really active chat. As I put, if you just scan the chat before you close, we'd love for you to all give us your feedback through the exit ticket. I dropped a link in there about the website, which is where the recordings and the slides and resources will go from this and the rest of the series. Kathleen and I both put our emails in there, but also you can reach us through everydaycounts@med.uvm.edu. That's like our team email. If you have we covered a lot of ground in the last 62 minutes, y'all. If you have questions or want other resources or say, wait, I don't have that in my community and I'm interested, just email us. We're always around. We're on email constantly. We would just be so happy to hear from you. And we're so grateful for this great discussion. And we hope folks will join us next week for our last session in this series, which is really going to talk about how the principles of community schools, which are relevant if you're a community school or not, might be useful for you as well in your work to engage students and young people. Thank you all so much. Have a great rest of your day.
Thank you.